As men move into their 60s and beyond, it's very common to notice small changes in how the body functions. These changes often happen gradually, so they may not seem concerning at first. For example, some men find themselves waking up more frequently during the night to go to the bathroom. Others may notice that their urine stream does not feel as strong as it once did. In some cases, it may take a few extra seconds before urine begins to flow after reaching the toilet. A man might also feel that his bladder never completely empties, even after he has finished urinating. These kinds of changes are extremely common as men get older. The prostate gland naturally grows larger with age, and this can affect how urine flows through the urethra, which is the tube that carries urine out of the body. Because this process is so widespread, many men simply assume these symptoms are a normal part of aging. And in many situations, that assumption may be correct.
However, medical research has shown that certain urinary changes can sometimes be early signals that something inside the prostate is beginning to change. The prostate sits just below the bladder and surrounds part of the urethra, so even small changes in this gland can influence how urination feels. Doctors who care for older adults often observe that these urinary symptoms may appear long before a prostate condition is formally diagnosed. Sometimes the signs develop slowly over months, and in some cases, they may even appear years earlier. This is why paying attention to these changes can be helpful. Recognizing potential warning signs does not mean that something serious is present. Many prostate-related symptoms are caused by non-cancerous conditions, but understanding what to watch for can help men know when it may be wise to speak with a doctor and have the prostate checked. Hello, I'm Dr. Robert Miller. I've spent more than 20 years caring for adults over the age of 60, helping them understand the changes that naturally happen in the body as we age. In my years caring for older adults, I've seen how often prostate problems develop quietly. Many men dismiss the early signs because they assume they're simply part of aging. But recognizing these signals early can make a meaningful difference in protecting long-term health. Before we talk about the warning signs, it helps to understand what the prostate actually is. The prostate is a small gland that sits just below the bladder. It surrounds the tube that carries urine out of the body. In younger men, the prostate is usually about the size of a walnut. Its main role is to produce fluid that helps carry sperm during reproduction. But as men get older, the prostate often changes. According to medical research, the prostate tends to grow gradually with age. This is why many men begin experiencing urinary changes later in life. Sometimes this growth is completely benign, meaning it is not cancer. However, in some cases, abnormal cells can begin growing inside the prostate. When these cells grow uncontrollably, doctors refer to this condition as prostate cancer. Researchers have observed that prostate cancer becomes much more common after the age of 60. That's why understanding the early warning signs becomes so important. Think of the body like a car dashboard. When something inside the engine isn't working properly, a warning light appears on the dashboard. The light itself is not the problem. It's simply a signal telling you that something needs attention. In a similar way, certain symptoms in the body can act like warning lights. They don't necessarily mean something serious is happening, but they may be signals worth checking. Doctors often see these signals before the underlying cause becomes clear. That's why paying attention to small changes can be very helpful. To better understand the symptoms we're about to discuss, it helps to take a moment and look at what may be happening inside the body. Under normal conditions, the cells in the prostate grow in a very controlled and organized way. The body carefully regulates how these cells divide, mature, and eventually replace older cells that wear out over time. This process allows the prostate to maintain its normal structure and function without causing problems. However, in some situations, this control system can begin to change. Certain prostate cells may start behaving differently from healthy cells. Instead of growing at a steady and limited rate, they may begin to multiply more quickly than they should. Normally, the body has signals that tell cells when to stop dividing. These signals act like a built-in braking system. But when cells become abnormal, they may stop responding to those signals. As a result, the cells continue to grow and accumulate. Over time, this buildup of abnormal cells can form what doctors call a tumor inside the prostate gland. In the early stages, this tumor may be very small and may not cause any noticeable symptoms right away. The location of the prostate plays an important role in why symptoms eventually appear. The prostate sits just below the bladder and surrounds part of the urethra, the narrow tube that carries urine out of the body. Because of this position, even small changes in prostate tissue can begin to affect the flow of urine. As the tissue grows or becomes thicker in certain areas, it may start pressing against the urethra. Researchers have observed that this pressure can slowly narrow the space through which urine passes. When that happens, men may begin to notice changes such as weaker urine flow, difficulty starting urination, or a feeling that the bladder does not empty completely. For many men, these subtle urinary changes are often where the earliest warning signs begin to appear. Not every man will experience these symptoms, and it's important to remember that many of these changes can also be caused by benign prostate enlargement, a non-cancerous condition that becomes very common as men age. Still, doctors often encourage men over 60 to pay attention when new urinary symptoms begin to appear, especially if they develop gradually or continue over time. Sign number 1. Frequent urination, especially at night. One of the earliest changes many men notice is needing to urinate more often than they used to. This change is especially noticeable during the nighttime hours. A man who once slept through the night may suddenly find himself waking up 2, 3, or even 4 times to go to the bathroom. Doctors refer to this pattern as nocturia, which simply means waking during the night to urinate. Clinical observations suggest that changes in the prostate can sometimes influence how the bladder behaves. Because the prostate sits just below the bladder and surrounds the urethra, even mild swelling or irritation in the gland can affect how urine moves through the urinary tract. When this happens, the bladder may become more sensitive and send signals to empty more frequently, even when it is not completely full. While nighttime urination can also be related to fluid intake, medications, or other health conditions, a noticeable increase in nighttime bathroom visits is something doctors often evaluate. Sign number 2. Weak or slow urine stream. Another symptom doctors frequently ask about involves the strength of the urine stream. Some men notice that the stream feels weaker, slower, or less steady than it once did. Instead of flowing smoothly, the urine may trickle or take longer to finish. In some cases, the stream may even stop briefly and then start again. This can happen because the prostate surrounds the urethra, which acts as the pathway for urine leaving the bladder. If prostate tissue becomes enlarged or changes in structure, it may narrow that pathway slightly. When the urethra becomes partially compressed, urine cannot pass through as easily. This is why doctors often ask about urine flow during routine checkups for older men. Sign number 3. Difficulty starting urination. Some men also notice that beginning to urinate takes more time than it used to. You might stand at the toilet and feel the urge to go, but the flow does not begin right away. Instead, there may be a pause of several seconds before urination starts. This delay can happen when changes in the prostate interfere with how the bladder and surrounding muscles work together. Normally, the bladder muscles tighten while the muscles around the urethra relax at the same time, allowing urine to flow smoothly. Researchers have observed that prostate conditions can sometimes disrupt this coordination.
When the signals between these muscles become less efficient, starting the urine stream may become slower or more difficult than before. Sign number 4. Feeling like the bladder never fully empties. Another symptom many men describe is a lingering feeling that the bladder is not completely emptied after urinating. Even after finishing in the bathroom, there may still be a sensation that some urine remains. Because of this feeling, a man might find himself needing to return to the bathroom again shortly afterward. This sensation can happen when the prostate interferes with the normal emptying process of the bladder. As men age, the prostate may gradually enlarge or change in structure. Since the prostate surrounds the urethra, these changes can partially narrow the pathway through which urine flows. When urine cannot pass through as freely, the bladder may not fully empty during a single trip to the bathroom. Small amounts of urine can remain behind. Over time, this leftover urine can make the bladder feel full again sooner than expected. Doctors often ask about this symptom during medical visits because it provides helpful clues about how the urinary system is functioning. Understanding whether the bladder is emptying properly can help guide further evaluation. Sign number 5. Blood in the urine or semen. Although less common than other symptoms, the presence of blood in the urine or semen is something doctors always take seriously. Blood may appear bright red, pink, or sometimes darker with a brownish color. In some situations, it may only be detected during a laboratory test rather than being visible to the eye. Medical researchers explain that this symptom can occur when abnormal or irritated tissue inside the prostate affects nearby blood vessels. The prostate contains many small blood vessels, and if the tissue becomes inflamed or damaged, small amounts of bleeding may occur. It's important to understand that this symptom does not automatically mean cancer. Infections, inflammation, or other prostate conditions can also lead to blood appearing in urine or semen. However, doctors strongly recommend medical evaluation whenever this symptom occurs so the underlying cause can be identified. Sign number 6. Pain or burning during urination. Some men notice discomfort, irritation, or a burning sensation when they urinate. This feeling may appear suddenly or develop gradually over time. One possible reason for this symptom is irritation or inflammation in the prostate gland. When prostate tissue becomes inflamed, it can affect the surrounding urinary tract and make urination uncomfortable. Doctors also know that infections of the urinary tract or prostate can create similar symptoms. Because several conditions may cause this sensation, healthcare providers often evaluate it carefully to determine the exact reason. Understanding the source of the discomfort allows doctors to recommend the most appropriate treatment. Sign number 7. Pain in the lower back, hips, or pelvis. In some cases, men may notice ongoing discomfort in areas such as the lower back, hips, or pelvic region. This pain may feel dull, aching, or persistent rather than sharp. Researchers have observed that certain prostate conditions can create pressure or inflammation in nearby tissues and structures. Because the prostate is located deep within the pelvic area, changes in the gland can sometimes affect surrounding muscles, nerves, or bones. It is important to remember that many older adults experience back or hip pain for reasons completely unrelated to the prostate, such as arthritis or muscle strain. However, when this type of discomfort appears together with urinary changes, doctors sometimes recommend evaluating the prostate as part of a broader medical assessment. When a patient begins noticing urinary changes or other symptoms related to the prostate, doctors usually start with a careful but straightforward evaluation. The goal of this first visit is simply to understand what the patient is experiencing and determine whether the prostate might be involved. The evaluation typically begins with a medical conversation. During this discussion, the doctor will ask several questions about urinary habits and any recent changes. For example, the doctor may ask how often you urinate during the day, whether you are waking up at night to use the bathroom, or if you have noticed a weaker urine stream than before. They may also ask how long these symptoms have been present and whether they seem to be getting worse or staying about the same. These questions help the doctor build a clear picture of how the urinary system is functioning. After the conversation, the doctor may recommend a physical examination of the prostate. One common exam is called a digital rectal exam. During this exam, the doctor gently feels the prostate through the wall of the rectum using a gloved finger. This allows the doctor to check the size, shape, and firmness of the gland. The exam usually takes only a few seconds, but it can provide useful information about possible prostate changes. Another test doctors often recommend is the PSA blood test. PSA stands for prostate-specific antigen, which is a protein produced by prostate cells. A small amount of PSA normally circulates in the blood. However, higher levels can sometimes indicate that the prostate is enlarged, inflamed, or experiencing other changes that require closer attention. Depending on the results of these first tests, doctors may occasionally suggest additional evaluations, such as imaging scans or other specialized exams. These tests help doctors look more closely at the prostate if needed. The important thing to remember is that these evaluations are usually quick, routine, and commonly performed, especially for men over the age of 60. The reassuring news is that many prostate conditions can be managed successfully, especially when they are discovered early. When symptoms are identified and evaluated in time, doctors often have more options available to help manage the condition and reduce discomfort. The treatment approach usually depends on several factors. Doctors consider the patient's age, overall health, the severity of symptoms, and the results of medical tests. Based on this information, they may recommend one of several management strategies. In some situations, immediate treatment may not be necessary. Instead, doctors may recommend carefully monitoring the prostate over time. This approach is sometimes called active surveillance or watchful waiting. With monitoring, the patient continues regular checkups so the doctor can observe whether any changes occur. These visits may include follow-up PSA blood tests, physical examinations, or discussions about symptoms. If the condition remains stable and symptoms are mild, no further treatment may be required for quite some time. For many men, medications can help manage prostate-related symptoms. Certain medicines work by relaxing the muscles around the prostate and bladder. When these muscles relax, urine can pass through the urethra more easily, which may improve the strength of the urine stream and reduce difficulty starting urination. Other medications may help shrink prostate tissue over time. By gradually reducing the size of the gland, these treatments can relieve pressure on the urethra and improve urinary flow. In some cases, doctors may recommend medical procedures to remove or treat abnormal prostate tissue. These procedures vary depending on the specific condition and how advanced it is. Some treatments are minimally invasive, meaning they require only small instruments and shorter recovery times. According to clinical studies, identifying prostate changes early often provides more treatment choices and allows doctors to select the most appropriate option for each individual patient. Along with medical care, there are also simple daily habits that may support prostate health and overall well-being. These steps are not meant to cure prostate conditions, but they can help men stay aware of their health and maintain healthy body function as they age. Many doctors encourage older adults to focus on small, practical habits that support the body over time. One of the most important steps is maintaining regular medical visits. Routine checkups give doctors the opportunity to monitor your health and identify any changes early. During these visits, your doctor may ask about urinary habits, review your medical history, or recommend screening tests when appropriate. Early detection is important because many prostate conditions develop slowly. When changes are identified early, doctors often have more options for monitoring or treatment. Regular checkups also allow patients to ask questions and discuss any symptoms they may have noticed. Staying physically active can support many systems in the body, including circulation, metabolism, and muscle strength. Regular movement helps maintain healthy blood flow and can support the normal function of organs throughout the body. Physical activity does not need to be intense to be beneficial. Many doctors recommend simple activities such as daily walking, light stretching, or general exercises suited to your ability level. These activities can help maintain mobility, support cardiovascular health, and improve overall energy levels. Another helpful habit is simply paying attention to changes in how your body feels or functions. If you begin noticing differences in urination, such as needing to go more frequently, difficulty starting, or a weaker stream, it can be helpful to mention these symptoms during your next medical visit. Doctors often say that patients themselves are the first to notice subtle changes in their bodies. Even small details can provide useful information during a medical evaluation and help guide decisions about further testing or care.
Before we finish, I want to share an important reminder. The information in this video is meant to provide general education about prostate health. It is designed to help you understand common symptoms and when it may be helpful to seek medical advice. However, this information should never replace the guidance of your personal healthcare provider. Every person's health situation is different. Factors such as age, medical history, medications, and other conditions can all influence how symptoms should be evaluated. Because of this, only your doctor can provide advice that is tailored specifically to your individual health needs. If you notice any of the symptoms we discussed, such as changes in urination, discomfort, or blood in the urine, it's important to speak with your doctor. They can evaluate your symptoms and decide whether further tests or examinations are necessary. It's also important not to start or stop medications, supplements, or treatments without first discussing them with a qualified healthcare professional. Another helpful step is taking an active role during your medical visits. Being prepared to ask a few simple questions can help make the conversation with your doctor more productive. For example, you might ask questions such as, "Could these symptoms be related to my prostate? Would checking my PSA levels help us understand what's happening? Are there any tests that might give us more information about these symptoms?" These kinds of questions help guide the discussion and ensure that your concerns are fully addressed. Doctors often appreciate when patients are engaged and interested in understanding their own health. Taking an active role does not mean diagnosing yourself. Instead, it means working together with your healthcare provider to make informed decisions. Open communication between patients and doctors helps ensure that important details are not missed and that the most appropriate care can be provided. As we get older, it's natural for the body to go through many changes. Some of these changes are simply part of the normal aging process. For example, energy levels may shift, sleep patterns may change, and certain bodily functions may feel a little different than they did years earlier. These kinds of adjustments are something many people experience as they move into their 60s and beyond. However, not every change should automatically be dismissed as just aging. In some situations, new symptoms can be the body's way of signaling that something may need attention. This is why doctors often encourage older adults to stay aware of how their bodies feel and function over time. The most important message to remember is quite simple. Pay attention to your body. You know your body better than anyone else. When something begins to feel different, whether it's changes in urination, persistent discomfort, or other unusual symptoms, it can be helpful to take note and discuss it with a healthcare professional. Recognizing symptoms early allows doctors to evaluate potential problems sooner. Early evaluation does not mean something serious is necessarily present, but it provides an opportunity to check that everything is functioning as it should.
According to medical research, identifying health concerns early often allows for more treatment options and better overall outcomes. In many cases, early conversations with a doctor can provide reassurance, guidance, and appropriate next steps if further testing is needed. If you found this information helpful, please consider liking this video and subscribing to the channel. Our goal here is to help adults over the age of 60 better understand common health topics in clear and simple terms. Thank you for spending a few minutes with me today. Take care of yourself, stay informed about your health, and I look forward to seeing you in the next video.